Good evening, everyone, and welcome to this evening's meeting of the Health and Wellbeing Board. I would say Happy New Year, just because we haven't met since the end of last year, but it feels a little bit late. But I hope everyone had a nice start to the year. So just kicking off with the agenda, the first is apologies for absence. I think there's just Chris and Andrew Otley. Can't see any others. So moving on to declarations of pecuniary interest, are there any declarations? I'll take that as no. And then minutes of the previous meeting. Can I take these as a correct record? Right, thank you. And just to refer to the minutes specifically, actually, there are some questions in there, sort of discussion points that we'll come to as part of agenda item 7, which is Merton Place-based partnership that I know Mark will run us through. And then moving on to the main part of the agenda, the first item is on COVID in Merton, so I'll hand over to Dagmar.
Hi everybody, good evening. I will give you a quick situational update as usual, but I'm also delighted that we have quite a lot of recovery topics, so I won't take too much time. If Clarissa, you help me with the slides, if we move straight on to the first slide, that gives you a good summary overview, and I think the main message for the epidemiology is good news. I'm really delighted. Finally, I am the bringer of slightly better news. R is down. That means the pandemic is shrinking, and we see it in the numbers. They are still really high, but the arrows go in the right direction. If you move us on. So this again, it shows our neighbours and ourselves in Southwest London, and you can see we had an extraordinary peak in London. I think the pandemic is meant to have peaked around the 25th or 26th of December, and we are now moving down. If you move me on. This is the impact in hospitals. Luckily, with the Omicron variant, we had lots of infections, but the impact on serious disease, it was much less, we think, due to population immunity, and thanks to our vaccination program, our booster sprint before Christmas, and also some naturally acquired immunity. If you move us on. This again shows you the distribution of infections in Merton, and the important bit there is that in all age groups case rates come down. Now what the graph doesn't show so much, between Christmas and New Year we were actually really worried because the over 60s started to creep up significantly. This was mirrored in a number of outbreaks in care homes, luckily often asymptomatic staff and residents, and no serious or very few hospitalization. What we now see though is that the youngsters are starting to creep up, so that is your green line, and in my data is always a little bit out of date. So we have now actually really got big outbreaks in schools, particularly in the primary schools. That is understandable because that is the age range that has not been vaccinated. And we have to take our hats off our teachers, but also parents. Some of you will be parents or grandparents. You will know the stress and distress that causes. We've got a primary with over 90 cases. Pressure on staff absences. But again, the reassuring news is that the health impact of children is generally mild, and so it doesn't translate into serious disease or hospitalization. So our infection prevention control team are supporting the schools as best as we can to come out of that really quite intense pandemic bit. If you move us on. This is important for Merton. It shows you the east-west division in infections, and as you can see, the lines west is blue and east is red, are really crossing. So we haven't got a significant difference. If you move us on. Similarly, we keep a good eye on ethnicity. If you move us on. This is testing. I keep those ones for your reference. In masses of infections, masses of tests. There was some shortage in testing between Christmas and New Year. In Merton, actually, we coped really well. We were well stocked, and our libraries always had tests available, Civic Centre, so our teams never ran out. And now I think the national supply issue, all of that has calmed down. If you move us on. This is important, that shows us deaths due to COVID. So fatalities in this new Omicron wave have fortunately really been low. So we need to keep an eye on excess mortality as well. There's obviously a lot of stress and strain in the system, but excess mortality due to COVID, certainly we haven't got any signals. If you move us on. And this is really, really important because with Omicron more than ever before, it is such a transmissible virus. Vaccination really is the best tool. And although you will probably know somebody who's vaccinated, even fully vaccinated, even boosters, might still got positive again, but it prevents serious disease. And the situation in hospitals has really proven that. So vaccination is still the most important show in town. Before Christmas, you will remember it was a concerted effort. It was the vaccination, yet another sprint to get everybody boosted to cope better with Omicron. It is now a much more measured, very targeted and focused approach, leaving nobody behind, tuning into specific needs of specific cohorts, communities, locations. And then obviously high on our agenda is the mandated vaccination for health and social care staff. So pulling down any barriers that we can find so that we get staff vaccinated. You will also probably follow up in the 12 to 15-year-olds, if you move us one slide on. They are lagging behind, and we have got quite obvious inequalities you can see in the geographies on the right hand side. So before Christmas we did first dose. There was quite a program of vaccination in schools, which was didn't lead to fantastic uptake. You see that it's the lowest bar on the left hand side. The cohort is now due also for second dose, but obviously if you haven't had your first, you can't have your second. So we're doing quite a bit of catch up, again, much more bespoke, the vaccination in the community and vaccination discussing with parents, with young people, with schools. Some schools have offered themselves up for vaccination sites during the weekend. So that's on the program at the moment. Lots of effort goes in there. And then the second one you will have heard, the little ones, the 5 to 11-year-olds, the vaccination for the high risk children is starting. That is led by the health service. They will be called because it's obviously a relatively small but very important cohort, because the individual benefit for these children and their families to be vaccinated is great. Whether the 5 to 11-year-olds will be offered universal vaccination is still being discussed. In case there is a positive decision, a timeline would be around Easter. So certainly not for the current Omicron wave that goes through our schools, but for protection in the future. I think that was my last slide. Yes. So Chair, over for questions.
Thank you very much, Dagmar. Nice to see a more optimistic outlook. Could I open for any questions to Dagmar on her presentation? I can't see any hands. I might just ask a question myself, Dagmar, and that's whether you could just provide us with an update on the situation in Merton around the vaccination of health staff in particular, and possibly also colleagues, just what the situation is looking like here, whether there are any possible concerns or challenges. Thank you.
Yeah, so if you allow me, Chair, for the social care element, John, or Phil, could I pass that on to you? And then obviously my health colleagues are better equipped to speak for the health element.
I can do the social care part. So the mandatory vaccination of health and social care staff comes in on the 1st of April. Staff need to have their first dose of vaccination by the 3rd of February. The legislation doesn't cover the entire of adult social care, so it doesn't cover social workers and OTs. They're partially covered in the first legislation about mandatory vaccines in care homes, nursing and residential care. So the teams that I'm responsible for would be our external home care providers, our internal reablement team, our mental health team staff, and our supported living units across the borough. They are the regulated services which fall under the mandate. So details of our reablement team, 100% of the staffing have had their vaccine shots. We've got about 350 carers and our external providers who are working with our clients in domiciliary care packages. And there's about 18 of those at this time are firm refusers, so they are clear that they will not be taking the vaccine. The rest of them have got to the first, a few others will have to the 1st of the month to accept the vaccine. None of our 30 home care providers are at this time reporting any problems. But we're really monitoring it, and Mark and Dagmar might speak about the work that we're doing to get the vaccine uptake amongst our workforce. We've got our supported living providers. Again, none of them at this time are reporting issues. That's in a lot of work from CCG, our commissioning teams, and public health, getting that message out there about vaccines. I'll pop across to Mark now, and he'll be able to maybe speak about some of the work that's been going on to get those people vaccinated as well.
Okay, thank you, John. Just to say that in terms of NHS staff, what I don't want to give you is data, because actually we're still collecting the data from the trusts and it's a changing feast. But what we do know is that around about the 90% of staff at the moment in trusts are vaccinated and fully vaccinated, and the trusts are continuing to work with those that aren't vaccinated and those that kind of are firm refusers, so to speak. Now, the level of firm refusers seems to be relatively low, but again, we need to keep working that through. What we're also doing is we're looking at the service specific areas. So even under the overall total, we will have variations at service level, and we want to make sure that we're kind of getting underneath those numbers, really to see what services this will impact upon. So that's at a trust level, and again at a community services level we're collecting that same data, and again from community services it's a relatively low firm refuser number, but again we need to work that through. In primary care, and specifically for Merton, we've done an exercise where practices were asked to kind of submit data to us last Friday and indicate whether it would pose them significant challenge. So I think within the Merton 22 practices, probably 5 have indicated that they need some additional support, and we are working with our primary care teams to provide that. Just to say that we are setting up a clinical hotline from Thursday, which is really about advice about vaccinations, promoting vaccinations. We've got a page on our website for all employers, and that ranges from vaccination information through to advice, employment advice, etc. And then also we're introducing a kind of overseas verification process, so that if you've been vaccinated in another country, there is a process to go through that we can validate those vaccinations. So it's an ongoing feast. It's a big ask, particularly as John said before, the 3rd of February. And we are kind of working on that on a daily basis. As a bunch of officers, we will touch base tomorrow just to make sure that we are assessing any Merton-specific risks across South West London. Back to you, Dagmar, I think.
If I just add in tuning in what potential barriers for staff it could be, and as John alluded to, we've got a cohort of what we call the firm refusers, but then there's a cohort as well that we think probably with tuning into their questions, if we can answer them, it might change their mind. And so offering the vaccination, for example, in the Civic Centre, a lot of staff find the Civic Centre very accessible, and we're running 3 sessions in 3 consecutive weeks to make it as easy as possible for staff. There are various webinars as well, but I really welcome the hotline because sometimes it's the 1-1 and very, very bespoke quite personal questions that I hope the hotline will cater for.
Thank you, Dagmar, Mark and John. Clearly a lot of work going into overcoming any barriers that are possible. Ellie.
Thank you, Dagmar. And you talked about the disruption in schools because of the high levels of cases at the moment, but you said lots of that is not due to high levels of illness, thankfully. Some of that disruption is caused by staff there who aren't vaccinated and therefore still need to isolate if they're a close contact. I suppose I wanted to flag that is a kind of concern of mine, that we've still got kids' education being disrupted by the choices of adults. And wondered if there's anything that health services are doing when they're not busy trying to vaccinate their own staff to think about proactively going to other workforces where it's a priority that they be in place for the rest of society to thrive. Thank you.
Shall I come in? I think Ellie completely spot on. We're working at different levels. We have escalated the issue up that you just raised, which is pretty specific for school staff, because school staff are in close contact, particularly in primary school, so they count as close contacts. We have masses of kids with positive tests in primary schools, so we have lots of staff having to self-isolate repeatedly if they are unvaccinated. Now, reviewing that, even looking at daily contact testing to get these essential staff back to support education, we have escalated right up the food chain. It is out of my hands to do any more, but I've got another meeting on Friday to catch up. In the meantime, all the vaccination bespoke sites that we are now having all over the borough are really focused at everybody. So families can come, youngsters can come, staff can come, and obviously not all staff in our schools live locally, but for those who do, that at least is one barrier less. And again, in terms of comms, we are specifically tailoring messages to certain groups where we're aware vaccination is low. And then finally, offering vaccination in schools by voluntary schools is also another opportunity to highlight the importance of teachers getting vaccinated. But anything that you can do as well, and if you have any idea and you need materials or somebody, anything that we can do jointly, we would love to help, because we are very aware around the issue.
Thank you, Dagmar. Mark, did you want to come in on that point?
I suppose it's just to back that up and say that at the Nelson, at the Wilson, we still have bookable sessions. It's about making sure that we are directing people to the CCG website about access and where you can get vaccinated in the borough. We are doing further work with schools at both kind of, we've started conversations with primary schools about how best to get some of the messages across, not only to the school staff, but also to parents. And we're getting some good information about how to kind of work with the schools on getting those messages across. I think also just to say that we've learned quite a lot from the first round of the 12 to 15-year-olds and actually changing the model of delivery for their second jab, and also looking at our PCNs just in terms of delivering the vaccine to the clinically vulnerable 5 to 12-year-olds. So just wanted to add, there's a lot going on. I would advise people to go to the CCG website. That should be the single source of truth for where to get vaccinated. Thanks.
Thank you, Mark. Simon, then Una, and then Vasa.
Yes, thank you, Chair. Yeah, I think Una might be on the same subject as me. We're also in discussion with Dagmar's team, with Una and Barry, around the voluntary sector support and the vaccination champion network. So that work is a big push between now and July for us to use the whole of the voluntary community faith sector to help improve the vaccination levels. So hope I haven't cut across Una's point, but thanks, Chair. Just wanted to mention that.
Thanks very much, Simon. Una?
Thank you. That's a very helpful report, Dagmar, and generally all that's just been said. One thing is of concern, actually, is the domiciliary and social care side. Because I am aware there are quite high levels, so certainly in one particular company, of people that aren't vaccinated. And there is concern, I know, as to what will happen. So, and obviously that's a private one, as opposed to one of the ones under the NHS or or Merton. But would there be access to that hotline generally? And I'm guessing they can come to Civic Centre, but of course, the problem is it's hard to persuade people to get there in the first place. So hence that hotline, which sounded a good point to pick up on. Because I certainly think that we do need to get, and also a bit of a wider point on getting out to the harder to reach people who also have been resisting, and we know that within the borough. We know that's London-wide as well. So it's really just a couple of points there. Obviously, the community champions, I think, do get out and help as much as they can to the community. But it's how do we get out even further and persuade those, particularly those that are working, and as Ellie pointed out in education as well. It is of concern, I think, generally. So thank you, and particularly as we're opening up and there's going to be less. People wearing masks again and all of that. So it's going to be quite a challenge, and so important to make sure that people are getting vaccinated. So thank you.
Shall I quickly come in? Una, really helpful points. Just to give you an example, so working very closely with the NHS on using our information and intelligence, where we should put our vaccination effort, and a little success story. These numbers are small, but a roving team went into our asylum seeker accommodation in Collier's Wood and vaccinated 19 people. Now you think 19 isn't a big number, but for me it is 19 very vulnerable people vaccinated. So I'm actually really proud, and that is the type of approach now. The numbers aren't eye-wateringly huge, but every single one is a real success story. And so a big thank you to the NHS for that offer. With regards to any private provision in terms of social care provision, can I ask John to help me out with that one?
So we have about 30 home care providers registered to provide care in Merton. We are in contact with all of those 30 providers. Some of them don't provide any care in Merton at all. So there's three large providers with nearly 800 staff provide no private or registered work in Merton. They provide work in South West London and across England. But we are still liaising with them because we are still the borough with the registered local authority. So we're still working with those companies to get their staff vaccinated. At this moment, the data changes on a daily basis, but for borough residents, so that's for the workforce working with Merton residents, we don't appear to have a big problem at this time. Of that 315 staff, it's about 18 are firm refusers. In no company working with any Merton resident, whether that's private or on a Merton contract, are reporting a problem at this time. It might be worth if Mark or Dagmar comes in and speaks about the work that's going on with webinars, with frontline staff, with the registered managers and with health staff to increase the uptake of vaccines. Mark or Dagmar, would you like to come in and speak about those?
I think you've probably just mentioned it, actually, John, so I wouldn't add too much more. What I would say is just we're communicating with local authority colleagues through to those social care providers. Absolutely, they'll have access to the hotline, etc. as well. This is a system-wide approach. We again touch base on a regular basis just to see where the risks might lie and what we need to do. And going back to Councillor Moulton's comments, you know, as Dagmar said, there was a real sprint before Christmas around boosters, etc. That resource is now being switched to outreach, trying to get into those hard to reach communities and doing much more pop-up led by communities, and we're there as a kind of an add-on. And I was speaking to our vaccination team this morning who said that actually 20% of last week's vaccinations were first vaccinations. So we are seeing a small trickle, it's not huge numbers, but we're seeing a small trickle of people who are actually coming forward to get their first vaccination, which I think is a shoot of positivity there.
Thank you.
Thank you, Mark, John and Dagmar for those comments. Were there any other questions or comments? Vasa, yes.
Sorry, still a novice. Yes, so normally Barry and Una are very good at organizing meetings and letting us know about it. And I think from our side, we could send a couple of vaccinators, a couple of clinicians to talk to the cohort specific, maybe the providers, carers, maybe the teachers, maybe anybody else. And I think it's all about talking, because those people are coming up to the vaccine center. Some of them come up and take the vaccine, but quite a few won't have a chat. And these chats can be 15 minutes to half an hour, even 45 minutes. And the main thing is after 45 minutes, they do take the vaccine. Because they have been listened to, their questions have been answered, their fears have been acknowledged, and there's respect shown. And I think that's absolutely important. And as Dagmar said, we don't count the numbers whether they did 10 or 9 or 15. Each person, if we can talk and half an hour later, they take the vaccine, it's good for them and it's good for us too. So vaccine sites, definitely there are pharmacists, nurses, clinical doctors. There are lots of people there who can listen, talk, explain. So just the message out there has to be, just come. Even if you don't want the vaccine, you want to talk, obviously hotline is there, but I'm not a hotline person. I like to see the person talking to me face to face. And therefore, if you're like me, turn up at the vaccine site, you won't be pulled in and vaccinated. If you say I want to have a chat, there'll be someone there to talk to you.
Thank you, Vasa. That's probably a nice point to close that that item off. So thank you again, Dagmar, for your presentation. Moving on to the next item, we have Eileen Buckton, who's the chair of the Safeguarding Adults Board, who's kindly come to present on the annual report to us this evening. So I'll just hand over to Eileen.
Thank you, Chair. Yes, I'm very pleased to have the opportunity to present the 2021 Adult Safeguarding Annual Report. There were two significant things, I think, about this particular year. I mean, firstly, along with all all public services, the importance for us as a kind of partnership board was to be able to maintain high safeguarding standards during the pandemic, which meant actually working in a very different way and finding kind of new challenges and having to respond to those challenges. So that was a very kind of key theme, obviously outlined in the report that's before you. I think the other significant thing to say about the year 2021 was that the Adult Safeguarding Board had a lot of new members, which meant that it was also a year where we wanted to focus on making sure that we have kind of a robust way of working, robust kind of governance, robust processes, robust ways of working in true partnership. And that has never felt more poignant, really, than during the kind of pandemic period. So you will see that we lay out what we wanted to achieve during the year, and quite a lot of the focus of that was on processes and being kind of smarter in our targets and looking at kind of our outcomes and thinking about the data that we wanted to collect as a partnership. And you will see in the report the results of that, where we have made quite a lot of changes of trying to increase the number of safeguarding referrals that are made in Merton, because it was relatively small before that. And I'm pleased to say that the numbers have gone up, and I think that is a good thing. And that there is then a very robust process as to how staff respond to those referrals, and to make sure that the people who've made those referrals know what has happened, so that people have kind of a real kind of faith and trust in the process itself. And what we saw during the pandemic year was a lot more referrals from the public, and not just from partner agencies, of neighbours, of friends, of local communities, feeling concerned about the person who lived down the street or the person next door, and wanting to make sure that they were all right. And not all of those concerns were safeguarding cases that we had to look at in a kind of full-blown way. But I think it kind of demonstrated really a sense of people wanting and being kind of concerned about people around them, and us as a partnership board wanted to make sure that we actually responded to those referrals appropriately and made sure that they were sent to the right places, that they got the right kind of response, and also taking on as kind of safeguarding cases if that was necessary to do so. What you will then find in the report is some kind of examples from partner agencies of the board itself, and quite a lot of kind of focus again on making their kind of processes more robust, and not only kind of listening to residents, but I think listening to staff, because staff's concern during that year, you know, staff worked under huge pressure. It was very kind of difficult sometimes to respond to kind of safeguarding concerns and make sure that they were being kind of supported in the right kind of way to do that. So a kind of, you'll see examples there of a sort of additional training, additional support, the council making more kind of sessions available for their staff, particularly for Black and Asian minority ethnic kind of staff who were wanting to reflect on and discuss the kind of high level of referrals from the wide range of communities across Merton, and examples as well in the health service of additional kind of training and support for people who were working on the front line who still had to keep safeguarding at the centre of what they were doing. So you will find those examples there. You will also then find some feedback from our subgroups. The partnership board has a number of subgroups, and you will see some of the work that we've been focusing on increasing training, to increasing awareness about safeguarding, making sure that we have a better quality assurance framework moving forward so that we can actually judge our effectiveness, and making sure that when something has gone wrong, that it's actually looked at in the right kind of way, and that we really learn and embed the lessons from that. We did have a particular sort of lens this year on the impact of COVID. We did a piece of work, for example, looking at care homes because of the particular concerns there were about COVID during that period in care homes, and the fact that families couldn't have easy access to their loved ones who felt concerned, and who often are the people who make referrals to us and weren't able to do so during this period. So I think there was some very good work in Merton about establishing a partnership with care home managers and with care home workforce during that period, and that work has continued. So there's quite a lot, I think, that we've been able to learn from that COVID work that I think is now kind of fully established in the way that we have moved forward. You will then find a section on the kind of safeguarding data. As I say, referrals went up, and you will see there about the evidence that there's far more kind of safeguarding referrals in people's homes than in care homes. That has gone up significantly, which you would expect during this period. And we, for the first time, we are now beginning to look at the impact of protected characteristics on safeguarding referrals. And we are beginning to see some differential in referrals between different kind of ethnicities across the borough. It's work in its early stages, but I think it will give us a much better picture as we move forward of how safeguarding is understood and responded to across the different communities in the borough. You will then also see that one of our kind of priorities is about making safeguarding personal, and there is data in the report about the extent to which that those who are victims of harm or neglect, or the families who report those circumstances, that they themselves feel that they have been listened to, and that there is kind of some impact of the safeguarding investigation, and that they feel themselves that what they wanted to achieve through making that referral has been achieved. And there has been a significant rise, I think, in the satisfaction level that people feel when they are in the situation of being a victim, or they're in a kind of family of a victim of safeguarding. And then there is something just right at the end of the report, just about some of the learning that that we are working on embedding from Merton safeguarding reviews, but also national reviews, and some particular work there on mental capacity and its impact. And then we've outlined for you the work that we are kind of currently doing this year. And I suppose overall, Chair, what I would say is that I was really impressed by the support from the council who support the kind of safeguarding board, but also the support from agencies across the borough who work together really incredibly hard and in a very kind of committed way during a period where they had so much else to do. And, you know, it was really good to see some very kind of effective partnership working. And I hope that does come across and is reflected in the report. I'll stop there, Chair, and answer any questions.
Thank you very much, Eileen. A really motivating presentation, I think, and a very comprehensive and accessible report. I think really highlights, as you were saying, the huge amount of work that has been put into this, but particularly, as you mentioned, making sure that the resident voice is really incorporated and reflected throughout. I will just open out to questions, if there are any questions to Eileen on the report. I did have one initial one. I think throughout the report, there's quite a lot of focus on the priority around working with partners. And some of that feedback from partners is reflected in the report. And just reflecting on the fact that at the Health and Wellbeing Board, we have a number of partners around the room and obviously online. And I just wondered, from your perspective, reflecting on this report, what you would want to see in terms of partnership work moving into sort of next year, 2022-23?
I think, Chair, that you know, and it may be that partners kind of want to comment on this themselves, but I think that we gained so much from the work that we did during that year, that obviously one of the things I would really like to see that the partnership work continues, and in particular, I think, of looking at what it is that the board can give over and above the work that each kind of individual agency who are a member of the board actually carries out. And I think that's, you know, already beginning to be reflected in the data that we're bringing together. So this isn't just data that's provided by one agency, and historically that's kind of been the council, but that we are looking at wider kind of safeguarding arenas. So looking, for example, at the transition work between children's services and adult services, looking at those young people who don't necessarily come into adulthood and receive public services, but who are themselves very vulnerable, and perhaps living in family situations where the families are vulnerable as well, and how we start to respond in multi-agency ways of working that reflect that, and therefore do a lot more preventative work, so that we're not just dealing with those people that we have traditionally worked with in terms of safeguarding, but trying to kind of widen the net in terms of preventing harm and preventing abuse, and much kind of more of an emphasis on preventative work through multi-agency working. And I think also through a multi-agency perspective of raising awareness. I think there's so much more to do in terms of the very different communities across the borough. I mean, safeguarding itself is quite a difficult concept and word to understand. So how can we get everybody to understand about harm and abuse and come forward and be part of making the borough a safer place? And I would like to see that, I think, taken forward through a kind of multi-agency way of working. And I feel now we've got a kind of firm foundation on which to do that.
Thank you very much. Ellie.
Thank you very much, Aileen. So this isn't my area of expertise, but I know in children's we publish some of the reviews that we do into serious incidents. So when you talk about these kind of small number of reviews that are undertaken, are any of those public, or are they just seen by the board and by the partners?
No, if there is a serious adult review, it is published in the same way. I mean, it may not be published in full because of reasons of, you know, some sort of protection around the family or family members, but usually the report would be published in full, or certainly there would be a summary. There just didn't happen to be any that were published in that particular year, but there are some in train that will become published in this year. And the work that we did about the learning was from a review from the previous year. But similarly to children, the emphasis is on learning, but there is an emphasis too on, you know, openness and transparency and being clear about, you know, what we've learned as a partnership.
Thank you. Una?
Thank you. I thought it was a very good report and very comprehensive. Like Ellie, I had concerns there about the actual reviews, but I'm pleased to hear that action plans and so on do come forward into the public arena. So that's good. In terms of the actual concerns, obviously, it seems to me a concern that we're up from actually what was 483, I think, in 2018-19 to 830 now. I appreciate what, so it's like anything, I guess. Sometimes it's better to have the reports made, and I hear that as it is with domestic abuse and so on, but it still has to be a pretty big concern that, you know, we pretty much nearly doubled those concerns. So I just wondered if you could comment a little bit more on that. I mean, obviously the fact that it's 63%, I think, reported in people's own homes, which which is a pretty staggering number. Yeah, I just feel a bit uneasy, you know, and I just wonder how we, I mean, I appreciate the report obviously is on safeguarding and the preventions, but clearly there's more that we can all try and do to keep those figures in a better state from my side. But thank you.
I mean, I appreciate your concern. You know, I mean, I think you know that you know the numbers do appear large, and I think, but I do feel that they have grown for two reasons. I mean, firstly, I think that people did actually refer more during the pandemic because they felt cut off from people in their families, or people felt cut off from the networks that they would normally use, and therefore their kind of levels of concern were raised. So I think it was partly about the pandemic itself. But on the other hand, I would prefer to see more people referring. If all of those were true safeguarding cases that had to be taken forward and went on to the next stages, I would be really worried. But it's about 50% of them, which is what you would look for. You would look for about, it's just slightly under 50%, I think it's 46%, that then get taken forward as a safeguarding referral, which would be about right in terms of the balance that you would be looking for. So I obviously, what I was saying earlier about how I would like to take things forward, I do want there to be a greater emphasis on prevention. But on the other hand, I want more kind of awareness, really, of safeguarding as a whole. So as long as I feel that all of the concerns are being responded to and people are being signposted appropriately, because sometimes it isn't really about safeguarding, it's just that somebody needs a service that they're not getting, or somebody needs a bit of advice that they're not getting. As long as they're being signposted appropriately and people aren't falling through the cracks, and as long as we're getting it right, that when it is safeguarding, when it's real harm and abuse, we recognise that and we're getting that right and moving that to the next level, then, you know, I'm happy that the numbers are, you know, feel relatively large, if you see what I mean. I think it's about how you spread the net and respond, really. And I felt before that actually the numbers in comparison to the rest of London have been relatively low in terms of the number of safeguarding referrals that were taken forward. And this, it feels more balanced now.
Thank you very much.
Thank you, Eileen. Vasa?
Thank you. And thank you for the report, and thank you for also telling us that you're also looking at the data with the lens of the protected characteristics, because I think that might tell us some stories which we need to look into. While you were talking, it came to mind that I know the meaning of the word safeguarding in English, but if you ask me to say safeguarding in Tamil, I wouldn't be able to do it because I don't know of that concept in my mother's mother tongue. And I think that is telling to me, and I think we need to look into that a bit more, because culturally, socially, religiously, there are maybe groups which may be cross with me for trying to translate that into a particular language, because they might feel, well, we look after our families very well, and that's what we do type of approach to this. And I think families do try their best to look after their loved ones, but sometimes they need the support, and your other emphasis on prevention, to put the support in so that accidental neglect, or accidental abuse, or accidental safeguarding concerns don't arise. And I think there's a lot of work for us to do in that aspect, just as we did with the vaccines. I think we need to go into the society a bit more on this topic. I think child safeguarding has had much more publicity and much more reports published, and you hear about it in television programs and news items. Adult safeguarding doesn't really sometimes get there. I'm not begrudging child safeguarding's importance, but I think we need to bring adult safeguarding also onto the table a bit more. And I think that's what we in health can do, to go back to the vaccine learning, to go back into communities and talk about this. And before I come next time, I'll try and find out the Tamil word for safeguarding.
I absolutely agree with you that I think, I mean, you know, even the word itself, I think, is difficult for an awful lot of people in terms of, you know, to understand what it means. And I don't think there has been the same kind of emphasis in terms of keeping adults safe from harm and abuse. And I think this is why I think we wanted to do the work around the data, and we are beginning a whole programme of communications and engagements through the voluntary sector, through working with our colleagues in the voluntary sector with different communities in Merton. I think for this very reason, and I do agree with you that I think we have to explore the concept more, and we have to get across what it means and what it kind of means in different kind of contexts and within different sort of families, to keep people safe and from harm. So I absolutely agree, and it's very much, I think, at the heart of what we're trying to take forward.
Thank you, Eileen. I can't see any further hands. So just to say thank you very much for coming and presenting your report, and for us to have the opportunity to read through it. And we look forward to seeing you again soon.
Thank you very much, Chair. Thank you, everybody.
Thank you. And we now move on to agenda item 6, which is promoting child healthy weight and tackling diabetes action plans. And we're being asked to effectively do 3 things. The first is to consider and endorse the refreshed child healthy weight action plan, and to note tackling diabetes action plan. Also to champion the priority for healthy place, particularly around the food environment. And the third is how individually we can champion and support the priority for making child healthy weight everyone's business. So I will hand over to Julia to present the report.
Thank you very much, Councillor. Can everybody hear me okay? Great, thank you. So I will just really give a brief introduction to the report, because I think want to give plenty of time for discussion. So the report presents, as we've seen, the refreshed child healthy weight action plan and an update on the diabetes action plan, and they're presented together because of the linkages between healthy weight and diabetes, and they have a shared priority for promoting healthy place. They also in the paper have highlighted the impact between the COVID pandemic, and that they're both very much a priority within our COVID recovery programs. So I think that the key challenges we're facing at the moment are in terms of child healthy weight. We have seen really significant increases from the latest data in child healthy weight. So we are quite confident that our figures in Merton, although we can't actually publish them, are similar to London levels, where we've seen significant increases in both our 4 to 5-year-olds and our 10 to 11-year-olds in terms of obesity. So and if we look at our 10 to 11-year-olds, if we combine overweight and obesity, since pre-pandemic, we've seen a 7% increase, so 45% of our 10 and 11-year-olds, that's our year 6s, is indicated that they are either overweight or obese. So the pandemic is clearly, emerging, that is having a big impact in terms of, the restrictions that have impacted on children, the closure of leisure facilities, the sort of disruption to routines, and also the challenges around affordable food and the increase in food poverty and use of food banks. A significant thing that we've highlighted in the report is the links between the increase in mental health issues during the pandemic, between stigma and the increase in eating disorders. So there was a significant national increase in referrals for teenagers to eating disorder services. That data has been published recently, and they're obviously interconnected with healthy weight. So we think those themes are really important and an area that we need to prioritise in terms of how we address healthy weight and child healthy weight going forward. The report sets out some of the themes that we have and achievements that have been addressed already. We have had a child healthy weight action plan for a number of years. So we have made some achievements in terms of addressing the environment through restricting advertising of unhealthy products to children, increasing access to water, putting restrictions around fast food, promoting active travel. We've also, during the pandemic, really focused on addressing food insecurity and tackling food poverty, and we're continuing that work with our partners. The priorities going forward are really to make child healthy weight everybody's business, so focusing on communications, training, trying to embed a think family approach, and also to providing support for children and families. So one of the areas we're really excited about is the development of a children's social prescribing pilot, which will focus on child healthy weight and low-level mental health issues. But very keen to particularly discuss how the board can support and champion our work on child healthy weight, particularly in terms of communications, and also embedding that think family approach. So if I just go on quickly to talk about tackling diabetes. So many members of this board will have been involved in the Diabetes Truth programme, which took place pre-pandemic. And you will know that the burden of diabetes is increasing across the borough. The pandemic has had a number of impacts on diabetes, both in terms of the disruption to access to services. So we've seen a reduction in new diagnosis of diabetes and potentially poorer disease control. There have also been direct impacts from the pandemic. So diabetes was the most common pre-existing condition in deaths where COVID was an underlying cause. And also there is an indication that there's been an increase in overweight and obesity among adults during the pandemic, which again is increasing those risk factors for diabetes. So in terms of the work that has been undertaken so far, so this board approved the diabetes action plan, and work has been continuing despite the pandemic, both in terms of setting up a diabetes champion network, undertaking the National Diabetes Prevention Programme, undertaking a quality improvement programme. You know, lots of good work has taken place. In terms of future priorities, they're set out on page 42 of the report, and include a real emphasis on increasing access to education programs, and particularly at programs aimed at South Asian communities. So those are some of the priorities going forward. And I think the question that colleagues wanted to really ask the panel was, you know, what's the one thing that you could do to contribute to tackling diabetes? So to consider that question. The third theme I just wanted to touch on before I stop was really the focus on healthy place. So this is a combined priority for both diabetes and child healthy weight. So how the environment shapes opportunities for physical activity, shapes our food choices, and we very much you know, recognise the close links between action to tackle healthy weight and the Council's commitment to tackling climate change as well. Some of the priorities that we want to look at going forward are refreshing our health in all policies approach, and looking at how we can really embed going forward a sustainable food environment, focusing on sugar and sugar reduction, continuing a focus on physical activity and active travel, and working with our schools to promote healthy school neighbourhoods. The GLA are relaunching their school super zone programme, and we want to very much you know, launch that within our schools. I know at this present time schools are very preoccupied with the really high number of COVID cases, but I'm hoping when we're over this period, they'll be ready to engage on some further work around child healthy weight. And I think the question again for the board that we wanted to ask was, how can the food environment be shaped so every resident can have access to healthy, affordable and nutritious food. Just a final thing that I just wanted to emphasize, and I'm sure everybody's aware that both child healthy weight and diabetes are big health inequalities issues. We know that there are much higher rates of child obesity and overweight in the east of the borough, and it affects different Black minority ethnic communities as well. Likewise, we know that diabetes is higher prevalence in South Asian communities. So I think it's really important when thinking of our responses to really have those health inequalities, in issues at the forefront of our minds. So I'll stop there. Dagmar, I don't know if you want to come in to add any final comments.
No, I think you've done a super piece of work, and it is a real example of collaborative work. None of us can crack diabetes on our own. I remember Vasa coming as a clinician to the Health and Wellbeing Board. It is now quite a while ago, to said, board, help us. We clinicians can't do it on our own, and that obviously persists. I wanted particularly the help for the board, and we hear about mental health a little bit later. The striking link between stigma and when we talk about healthy weight. So for us as a board, for us as a public health community, to really rethink how we talk about healthy weight in a non-stigmatizing way, because the increase in unhealthy weight and disordered eating, when we also have food poverty, it is a particularly vicious triad of problems that are very interlinked. And so I feel a little bit of reframing and rethinking how we're working with our communities, understanding the interdependencies is required to tackle this issue. And you're all very well placed to help with that.
Thank you, Dagmar, and thank you, Julia, for this really useful report. And I think we can all agree that healthy weight and diabetes are sort of core priorities for us in Merton and across South West London as well. Could I open up for any comments or questions, or possibly any responses to some of the questions that are in the paper? I think the first one Dagmar referenced just now, which is around how we can individually support through communication and engagement to tackle sort of issues of stigma and mental well-being and healthy weight, which is obviously quite a big challenge in itself. But I don't know whether anyone has any initial thoughts or comments on that. Emily?
Thank you. You'll be unsurprised to know that I have views on this. This is a really useful piece of work. I've got a couple of, I suppose, anecdotes and then a kind of broad strategic point. So firstly, on the kind of schools getting back into this world, I've just been delighted that since schools have opened up again, they have gone straight back into doing school sports and doing inter-school sports competitions and getting more physical activity going. And I think it's just great that schools haven't just focused on the kind of, academic catch-up, but have thought about the wider physical well-being of children, but obviously lots more to do there and lots more pressure that can happen. Secondly, on the kind of stigma attached to it, I have a good friend whose daughter had put on weight, and they got one of the letters saying, "We think your daughter's put on weight and can you come and see us?" And both they and I, when I looked at the letter, were really delighted with how it's phrased. We thought it was phrased really sensitively, really encouragingly, really non-stigmatizingly. And this family were very, very happy to engage and kind of go along to the service. They happen to be a kind of white, middle-class, well-educated family. I would love to know if it would have been received as well in different families. And I suppose that's something worth thinking about. The message might be different for different groups. I think, I suppose the bigger point I wanted to make is, how do we make it everyone's business? I think that's something that we politically as councillors should definitely take on board. And there's small things that we can do in our own local areas to make it easier for children to take part in activities. A brilliant example of this is there's a group of councillors who are setting up a junior park run in Figs Marsh with some other volunteers, and that's hopefully getting going, I think, next month. And anything that just makes it easier for children to get out and get active. So we should all be thinking about how we can do that. Thank you.
Thank you, Ellie. Mohan and then Mark.
Thank you. Wonderful. That's a great report to see and see the vision in terms of how we can support childhood obesity. And I've got a few comments. How can we support engagement and the stigma around it? In particular, I think often we often sort of skirt around the obesity issue because we don't want to upset anyone. We often don't, we feel offended, and certainly when it's mentioned, certainly in a clinical setting, that can often cause barriers. And so we need to make it less of a stigma and actually talk about it more and actually address it sort of early on, preventative, and see what we can do before it becomes an issue. So that would be my first comment. Easier said than done, but actually it's something which it does require promotion, education, and all of us sort of making people aware, and actually having opportunities to get weight done or exercise or support around it at any given opportunity, so people are made aware about how important it is. I think often they get it too late and then it becomes quite battle. In terms of the Fixed Marshall Run, I think that's brilliant, absolutely brilliant. And it just made me think, you know, a lot of councillors do walks around wards, whether that could be a community event where you could get sort of local residents to come and join your walks and give them a bit of a talk about the local area, while also endorsing exercise. Just a thought when you mentioned it earlier. But I think with the family unit, that's key as well. Often they will then be able to feed the children who will then unfortunately become obese, and so we can't just tackle the children and young people. It also needs to be the adults as well, and actually we need them educated more as well. So I think this will align quite nicely with the Tier 2 service, which I think is due to come out fairly soon, and also the child social prescribing pilot, which again very excited about, but looks very different to the adult social prescribing model, which is placed in practices. I think the children and young people will be placed in a different place. Where is the magnet which brings in children and young people, where we can opportunistically support them with these questions? So lots of thoughts, and really, really excited. So I'm happy to get involved with any of this. Thank you.
Thank you, Mohan. Mark?
Mohan stole my thunder, but I think it's just basically to firstly acknowledge the great piece of work that's been done. But this is exactly the kind of thing that we should be working on together, and that's across not just organizations but across age groups, across sectors, etc. So I think just to share Mohan's excitement really, and for us to kind of really get behind this piece of work going forward.
Thank you, Mark. Una?
Thank you, and likewise, I think this is a great report, although it's very sobering to read, and to read some of the levels of childhood obesity. And I've also been reading some of the projections for not just Merton, but London as a whole, which is, you know, really quite shocking. So all we can do now to help stem this, the better. And as councillors, I do think this is an area where sort of cross-party and amongst us all, we can all get out and try and support. I mean, in my ward, we've been supporting a walk and talk group, because although some people do like running, of course, there's a lot of people that don't. So even just starting walking around the park, and we all love talking, as do kids. So yeah, I mean, it's great for kids, dogs and everything. So that's one, and I know they want to encourage other groups to do it. I mean, I've banged on for years about parent and baby classes, because of course catching people early, that's a simple thing, and just really getting out there that how important that is. And then again, you know, baby classes and parents groups can lead on into bigger things, and using those to put out good advice both on exercise but also nutrition and so on, because you know, it's all as we've just said, you know, everything's sort of linked, you know, the mental health and so on, and it all starts so early, I think, with children as well. So yeah, I mean, I do think that we can all champion, whether it's a green gym for the local, you know, park, to a better playground, you know, some better playground equipment. There are ward funds that are always available. So, so to my mind, yeah, the more I can think about a bit more that we can do locally, the better. And then to outreach further with some of that good work as well. So the more we can encourage everybody to get out and do that exercise. I mean, I got 3 boys, and it was living hell to be at home with 3 boys that hadn't been walked, you know, daily really, and come rain or shine, that's what we were doing. So to me, it's all part of a natural state, was to be out and exercising, and then coming back and having some nutritious food. But to have too much sugar as well, well, it's a recipe for disaster if kids aren't outside and there's extra sugar. And in fact, I was quite interested by a school that had actually taken away puddings. That went on the national. That was quite interesting, because they found there was a link between bad behaviour in the afternoon and having puddings, which seems sad to take away the puddings, but equally it was quite interesting that they had, you know, there was a correlation. So that's quite interesting too. But certainly we'll do what we can. Thank you.
Thank you, Una. Ellie?
Just one further point. I don't think I've seen it mentioned here, but my understanding is there's a pretty good evidence link between breastfeeding rates and obesity. And so anything that we can do to improve breastfeeding for as long as possible. I should make very clear that's at a population level. I'm not doing any blaming of any individual who, for whatever choices they're making, but there is evidence of a link at a population level. I understand. I will happily be corrected by the health experts.
Do you want me to just to come in there? Yes, I was just going to say that absolutely there is a link, and in the more detail, it was probably just an oversight on our part. In our more detailed plan, lots of work has taken place on supporting and promoting breastfeeding through children's centres, through our health visitors, through the kind of as well as the, you know, a specialist breastfeeding support clinic that our health visiting service provides. So absolutely, that is definitely a priority.
Thank you, Julia. Mark, did you want to come back in? No. Okay. Dagmar?
Yeah, so very briefly, a bit of reflection on the stigma stuff. So Ellie, with your work in schools as well, and obviously Jane in CSF, a lot of children and young people have been really active and interested in the sustainability agenda. And what is actually good for the planet is generally also good for your health and for your waste. And sometimes you can avoid the whole discussion about your body and weight and looks, and say what can we do and what fires people up to work on. And you can capture possibly another angle of this really tricky and complex issue by working concertedly around sustainability. Because if you think about active transport, or if you think about sustainable food choices, there's a lot of cool benefits to be gained. And Chris can't be here today, but that's what behind the scene we're also trying to really get more concerted action out between the climate emergency work and our promotion of healthy weight without stigma. And I think schools are really important in that.
Thank you, Dagmar. I just wanted to make a point actually about the stigma point, because I appreciate there's been a lot of discussion around sort of healthy diets and also sort of exercise. But I imagine that obesity is very complex. And in addition to, for some people, diet and exercise does work, but then for others, there are more complex factors, which I think the Royal College of Physicians has come out and talked about obesity being a disease, for instance. And I just wondered around sort of access to services as well in Merton, when people do present around an unhealthy weight, say what provision there is in Merton for people beyond the sort of diet and exercise as well.
Would you like me to come in on that point?
If you could.
So for young children and young people, we have a family start service, which is delivered by our school nursing service. So that provides healthy weight management support on a individualized basis, so sort of tailored to the individual. It was based on a pilot that had been undertaken in Richmond and had been successful in supporting families, so we have adopted that in Merton. We've had some issues obviously maintaining that over the pandemic period, but that again is proving popular with families. I think previously we'd found some of the group work approaches were difficult, and I think it possibly was linked to stigma. So this offers some individual support for families, as well as signposting to other group-based activities and exercise and so on. So that's the main support for families, and it's accessed via the sort of referrals through the NCMP programme, and as I said, delivered by CLCH through the school nursing service. And then in terms of adults, the offer is through One U Merton, the offer of kind of support through that process of having an individual conversation and then setting goals and targets. So we do have a children's and an adults service offer, but I think there's also always more that can be done to support families.
Thank you, Julia. Mark?
Just to say thanks, Julia, that's really, really helpful. And I just wonder, going back to our kind of like all taking responsibility for this and all getting behind it, there is something about how we publicize those access points across the system. So recently we just gave our secondary care colleagues a list of when primary care was open. And it made such a difference because suddenly they knew what they were referring into. And, I wondered, about obesity when, hospital appointments, are they integrated into these pathways out of hospital? And I think that's something that we just need to think about going forward.
Thank you.
Thank you, Mark. Jane?
I guess I just wanted to reflect. So there's been quite a bit of discussion about how the approach we might use is sort of balanced and supportive, no blame. I just wonder what language we're using around the clinics or the support that we're offering, so that we're sort of changing the narrative a bit around what is what is healthy, because at the other end of this spectrum, as Dagmar alluded to, we have also got disordered eating with young people who are so concerned about their body shape. They're being shamed in a different way. That there's something, isn't there, for all of us about how this becomes a sort of a normal way to have a conversation about the exercise you're doing, what you're eating. And I really like the idea about how we could tie it into sustainability, or because actually young people are very interested in that. So it just struck me there's lots of ways we can think about how we describe this in a way that maybe changes the feeling that people have about whether they want to engage or not.
And just to come in, if I may, one of the things we want to do, we're working with 4 young inspectors who are working on a range of public health programs. We're really keen to get them involved, particularly in the communication and messaging. We had a really good discussion at the Children's Trust Board, and there were some great ideas coming from the young inspectors involved in that as well. So we want to kind of build on that and make sure they're involved in how we develop and take this forward.
Thank you, Julia. I can't see any other hands, but there is clearly a lot of excitement and enthusiasm around this topic. And I know that we haven't spoken so much about diabetes or also some of the other questions around the food environment. So it feels like there's an opportunity to bring the board back together at some point to talk about this in more detail. But was there anything else, Julia, that you wanted us to cover in this, or just to effectively approve the report?
Firstly, I'd just say I really appreciate the support the board's given. We'll certainly make sure we come back to you with with lots of activity. We have a multi-agency steering group that kind of drives the implementation of the board. So no, just very much thank you for the support of the board, and we'd be very pleased for you to approve the recommendations.
Thank you, Julia. So moving on to our next agenda item, which is Merton Place-based partnership. I will hand over to Mark to present.
Okay, Clarissa, you very kindly will put my slides up, and in true NHS style, I'm trying to keep the slides to a minimum this week and not talk in NHS speaky. So what we wanted to do was basically bring, we've had a number of conversations with you around the ICS and the development of place, and what we wanted to bring was just an update of where we've got, particularly around the Borough Committee being established. It's worth noting that in the planning guidance that came out on Christmas Eve to the NHS, the ICS implementation date changed. So when we were previously working to the 1st of April, that date has been now delayed to the 1st of July. We understand that the delays are due to, actually it was winter, we had a booster programme, we had Omicron, and so therefore it was felt that another 3 months for ICSs to implement would be a good idea. At a South West London level, what we would like to do is move to kind of shadow arrangements when we're ready to do so, possibly in April, before the kind of May implementation. But tonight, what we basically wanted to do was kind of touch base around what the Merton Place Borough Committee looks like, how the governance might work. And when I came previously, I asked some questions, and we just like to revisit those questions if that's okay. So I shouldn't take too long. And next slide, Clarissa. So we talked about the membership of a borough committee, and that borough committee will take delegated authority for a number of NHS budgets, but it really is a partnership committee. And so therefore we have people that are using the services, and the representative would be Brian Dillon from Health Watch. We've got local authorities representatives, John Morgan, Dagmar and Jane McSherry, who are in the room tonight. Social care providers. Now, we didn't feel that there was necessarily a front runner social care provider at the moment that we wanted to invite into the committee, but again, that needs to be considered going forward, and we should always make sure that our partnership committee, it updates itself. So actually, as we get more integrated going forward, actually, who should we have around the table? Simon Shimmons would be the voluntary sector representative, again, around the table tonight. And then the ICB executive lead, that will be a recruitment process that will happen in due course. The primary care provider leadership, we have gone out to all our primary care practices and clinicians, and we've asked them to nominate leaders, and we are going through a process at the moment. So certainly by the next Health and Wellbeing Board, we will have a name in the frame there. And then the providers of acute community services and mental health, Anne Brealey, who's the Chief Operating Officer at St George's, Jimmy DeWade from CLCH, and Vanessa Ford from the South West London Mental Health Trust. We have voted and nominated and agreed a convener. Some people are calling that the chair of the committee, and that's Vanessa Ford. And Vanessa is currently the chair of the transition group, and it was felt that she will certainly for the foreseeable future be the convener of the new borough committee. Next slide, please, Clarissa. Now, I did go into names there because I wanted to provide assurance that those names are known to us, that it is about the partnership. And what we wanted to do was just also show how the governance is emerging. So absolutely, the Merton Health and Wellbeing Board is a statutory and a meeting in public, and that is not for discussion. What we are doing is establishing the Borough Committee to sit alongside Merton Health and Care Together Board and really be part and parcel of that kind of that board and partnership approach. We believe that underneath that we will have to have finance and performance, because actually we're spending NHS budgets and we will need to monitor that and ensure that they are achieving the outcomes we want to achieve. We want to put a transformation section in there so that we come together and really talk about transformation and drive through transformation. And then quality. Often we talk about activity, we talk about finance, but we don't talk about quality. And we think that's a really important kind of tenet of the governance going forward. Special mention is that, and this is not about the individuals, so certainly within the voluntary sector, Simon is our representative, but we would like to have a broader conversation with the whole voluntary sector. The same with the patient and public involvement. We really do want to tap into not just Health Watch, but things like Young Champions, etc. So we want to really make sure that we're establishing a communication and a dialogue with our patients. And then there is also the primary care. We will have a primary care representative, but how do we talk to the broader primary care? How do we talk to the nursing staff? How do we talk to auxiliary staff, etc.? So we want to establish something that can really tap into that. Next slide, please. So previously, I came and asked were there any comments on that draft governance structure and also the membership, particularly with the draft governance structure. What we don't want to get into is we want to kind of develop this over time. We don't want to duplicate things. And as we go through this conversation, I think we will need to think about how Merton Health and Care Together and the Borough Committee really dovetail together, initially anyway. And also, was there anyone not on the list or any area that we haven't got on the Borough Committee? And then a real key question, and then we'll take the slides down, was just around, actually from a health and wellbeing perspective, how would you like to really make sure and be assured that we're integrating and that we're aligning everything that we do in the Borough Committee to the priorities of the Health and Wellbeing Board? So I'll stop there. Clarissa, you might want to take down the questions. So it's comments around the kind of governance structure and the membership. Have we forgotten anything, or are we on the right track? And secondly, how would the health and wellbeing membership like to make sure and assure themselves that we're aligning to everything that you do?
Thank you, Mark. Before I do open to questions or comments on those, would you possibly be able to provide a bit of information around, I suppose, that middle structure? So in terms of ensuring alignment and integration, the Health and Wellbeing Board and the Borough Committee and Merton Health and Care Together, would you possibly be able to comment on the type of content discussions that would be happening at the Borough Committee and Merton Health and Care Together, just so that it's easier to understand?
So I think that's a really good question, because I think within the Health and Wellbeing Board, we know that the Health and Wellbeing Board deliver the strategy. They talk about the priorities, etc., for the local population and the local residents, and we don't see that changing in any way. What we do see is that the Merton Health and Care Together was really established to drive through projects where some of the projects that we've talked about tonight were actually coming together as organisations, as sectors, would really benefit the work and the residents of the population. The Borough Committee is an NHS construct which basically looks at being able to delegate some of the NHS budgets down to a local level. Now, I personally think over time we need to have a conversation about how the Borough Committee and about how Merton Health and Care Together align even further. And are we duplicating things? But at the moment, because of the structure and because it is a place to land the ICS, I think that's a future conversation that we need to have. So I think the Health and Wellbeing Board is as is, sets strategy, sets priorities, assures itself about performance and that the services are moving in the right way. And then I think the Borough Committee and the Merton Health and Care together is very much about project-driven work to achieve those priorities and achieve those aims. Does that help, Rebecca?
Thank you, Mark. That's really cleared things up. Thank you. Are there any comments or questions or I suppose responses to those questions that we saw on the screen? I suppose just taking each of them in turn, the first one is around sort of the membership of the Borough Committee. Were there any comments on that membership? Anyone that anyone feels is missing or excluded perhaps? No, I think, Mark, that's all covered off. I think everyone
silent. I'll take that as agreement.
Happy with that. I've forgotten the second question, but perhaps if we take the sort of bottom one, which was around that kind of alignment. And I think to your point that in time you might see greater alignment between the Borough Committee and Merton Health and Care together, which is more project delivery, and the Health and Wellbeing Board being more sort of strategy and accountability. Does anyone have any sort of comments or points to raise on that? Or does that feel like a sensible structure? I feel like you've got the answer you're looking for there, possibly. Dagmar.
Yeah, hi. I think at the moment it is absolutely a sensible structure, because I would be loath of saying we're starting with a blank sheet of paper. We don't. We have done a good partnership in working before the local borough committee came along. And so the recommendation is very much to build on what we're strong about and see that as a real addition. And just reflecting back again, some of you will remember with the Health and Wellbeing Board, it doesn't just automatically drop out of the sky that this board adds value. It needs quite a lot of work. And some of the ideas we had reflected in the Health and Wellbeing strategy as well was not to overload this board at that time and say, in providers who want to go into much more details of specific services could easily flood and overload this board. So the idea was keep the board strategic, think particularly about the conditions that help people to thrive. So have Chris Lee from Environment in there, have the community voice really in their Health Watch, etc. And create the Merton Health and Care Together board explicitly with the providers in order to have a space to absolutely get into the details of holistic services. And clearly the two have to go hand in glove. It is not two different orbits, it is hand in glove. And so for me, we're starting absolutely right with the Borough Committee coming as the third member of that club. And we are now jointly starting to shape how we go forward. And as Mark said, absolutely with the view, can we shake out in the future some of these structures? But for the time being, I really welcome how we propose to start.
And thank you for that, Dagmar. That's very much appreciated. I think one of the things perhaps that we come back to the Health and Wellbeing Board, and this needs some thought amongst the officers and also the Merton Health and Care Together, is what are our ambitions around integration going forward? And that's something that we won't deal with tonight in 5 minutes, but I think that it's part of the conversation going forward and absolutely part of the health and wellbeing kind of steer to the Borough Committee and steer to Merton Health and Care Together as to how far we can take integration going forward. So I would probably just say that we are, we continue to bring these things back as a kind of touch point because we want to make sure that the Health and Wellbeing Board are cited upon them, but also at the point where, we do want you to also steer some of this as well as we go through certainly the next couple of years.
Thank you, Mark. Were there any sort of final comments or questions, Jane?
So I just think it's worth the board noting that, so I have fellow DCSs across the country who do not feel in any way part of this ICS development, or they don't feel part of the partnership, they don't feel part of the conversation. So it's worth just the board noting that in Merton, children's issues and the Director of Children's Services is a key part of the transition development.
Great, thank you, Jane. Mark, was that everything from your report? Did you have any other?
I'm more than happy to take kind of offline questions as well, or, you know, as people want to see how we are developing going forward. And this is, this is the Merton place that we're talking about. There is the broader ICS and the Integrated Care Partnership, which are part of other conversations as well. So I'll stop there.
Perfect, thank you, Mark. And we appreciate that you do regularly bring back updates on the ICS in terms of the progress. And then we'll just move on to our last agenda item, which is the CAMHS Local Transformation Plan. And I think it is Sarah Keane who's going to provide us with an update.
Yeah, thank you, Chair. I was wondering if I can just say hello and then go off camera again, just so that I don't get the dialect effect that might happen. Hello all.
Hi, yes, of course.
Wonderful, thank you. I almost feel like saying it's an oxymoron. I'm excited to be here presenting this. At the same time, we also know that what the pandemic has done to all of us, the impact of that on all of us, especially on our children and young people. So with that in mind, I think the idea of the LTP, the Local Transformation Plan, is very much galvanized around what the plans are to support the impact that has happened and our children and young people. Thank you, Clarissa. I was wondering if we can put the last slide so that the questions can be sort of held in mind whilst we, before I start. That's it, super, thank you. So if you can just bear these in mind, that would be really helpful, so that at the end, because I'm aware that this is the last agenda item, and usually, of course, this is not the graveyard slot, but it's still, we're at the end of things, so our energies can wane a little bit. And with the discussion we've had about obesity, I can't even tell people to take a sweet so that they can stay awake. But let's move on swiftly. Thank you. So if you can just bear this in mind. So what we would like board members to consider is how we can support delivery of priorities of the local transformation plan, particularly around our early support and prevention, ensuring children and young people can access early intervention, and also joint working to ensure a stronger partnership approach. Thank you, Clarissa. If you go back to the second slide for me, that's really helpful. Thank you. I think one of the key issues, and I've heard it said here, I think Jane just mentioned the partnership that exists within organizations, and this is very clear. That's one of the things I want to acknowledge here, that we work very strongly together as a partnership, especially around the CAMHS board and CAMHS issues, which is really helpful. And so with that in mind, I wanted to just mention that the local transformation plan has been published in draft, and the idea is to see how we can inform it. So different areas are presented so that we can inform the final version of it. So what is important to note is that in the past, we basically had a borough-based local transformation plan, child and adolescent mental health local transformation plan. This has now been across Southwest London region because we are now one CCG. And so this is what has happened. However, it's important to note that we still have a local, sort of a place-based vision that is driving us, or driving the local transformation plan, which I'll say LTP. So children and well-being of families and carers are very much informed within what is happening. And the focus is also around the ongoing impact of the pandemic on children and young people. So it's very important for us to constantly hold that in mind, because it's still continuing, as we know. Thank you. Next slide. Thank you. So the ambitions, therefore, for especially the local transformation plan this time is galvanized around we want to make it easier for children and young people to access support. I think we know that there has been an increase across all sectors of child and young people services. So we want to see how we can make things easier for our children and young people to access. We also want to see how we can improve how services are organized so that it makes it easier for them to access the services that we have commissioned to be provided. So the priorities, the ambitions that are driving the priorities are very much galvanized around promotion of resilience, prevention and early intervention. As well as that, of course, we don't want to forget the fact that we also need to ensure that our children and young people who are most vulnerable, the support is also available for them. So it's very important. One analogy I actually heard, which I thought was very powerful, a word picture, was almost a tap that is overflowing, and services are just galvanized around mopping the overflow of the sink, whilst the tap is still turned on, and never shall we finish mopping. And the idea is, how can we work to stop the taps overflowing whilst we mop in tandem? And that is very strongly what the LTP is galvanized around. Thank you, Clarissa. Next slide, please. So with that in mind, we are saying that within Merton Place or across the LTP Borough base, we're saying that we are starting from different places. Usually you hear a lot about equality, and we're saying equality doesn't really, is not fair. And we want fairness. And with that in mind, we're talking about equity. If we give everyone exactly the same, expecting that we're making them equal, it assumes that everyone is started from the same place. But of course, we haven't. There are some people who are taller than others. And if we just become equal in terms of the provision of services, then our young man in the purple will not see over the fence. And so it's very much around compensating and knowing that we're not starting everyone from a level playing field. And how can we address those? And that is informing this transformation, and especially around the Merton base. Thank you. Next slide, please. So with that in mind, the blue ones are very much galvanized around the Southwest London LTP. And then the green ones are very much what we are doing in Merton. So you'll see that prevention and early intervention is a key element. We want to make sure that in years to come, we are not at the same place of just mopping the water, but we're turning down off the taps or turning it down. And so some of the things we are doing in Merton is very much working in what we call a Thrive-like way. We're working across our systems because we know that not one organization can meet the needs of our children or young people and families. We have to come across as a system. It'd be like what Mark has just presented with the ICS and been contributed to. So we have worked with our colleagues to enhance the parenting offer to support the prevention and early intervention offer. And this is really being reviewed as we go along so that we can inform future demand and need based on what we are hearing from our parents and from our families and also from our workforce. Some of the things we have also done is during the lockdown, we did see a decrease into referrals for services. And then when systems opened up a bit, we did see a spike in many areas. So we have managed to enhance our talking therapies, which is provided by Off the Record. And we also, the other challenge we also faced were narratives around, when we turn 18, it's almost like a cliff edge. And then we're tapped into an adult world. And sometimes we're not ready for that. And so what we have done within that service is also increase scope within that. So we have up to 25. So our young people can be seen from 11 to 25, as it were, years old within that. Part of what we have also introduced in that service is, as a result of the pandemic, of course, self-harm was happening, but I think the pandemic has really exacerbated that, suicidal ideation and self-harm. So again, we have increased capacity within to support that. Within that offer, we have a parenting webinar or support that goes on, and they provide that for parents in how to discuss these with children and young people that they are looking after around self-harm, how to manage it, and to be comfortable in discussing that with them. So this is what is happening. The other key thing, which is very important, and we are very excited about, I know Dagmar is here, Julia and Mark, and the others who are and Jane, very much part of this, is around our mental health support teams in schools. So this is again focusing on our what we call the early intervention and prevention element. So we have in Merton, we're in many sense quite ahead. We have a cluster of schools who are all part of mental health support teams, Trailblazer. So mental health support staff are located in clusters of schools so that children and young people can be referred for emotional health and well-being support. That means that a child is well placed. We know that children are in schools. They don't have to leave the school to go for appointments in a different building, as it were. So they are co-located, or they can provide a service in-house, if we were to put it that way. So far, I think January, we have the staff who've been recruited for February, and they are starting this February. Once we have the staff starting in February, it means that the last cluster in Merton, which is focused on the Wimbledon schools, it means that we will have all our schools, our public schools, I should say, in the borough, able to access support, emotional health and well-being support in schools. So our schools will all be covered. If they do want to utilize the offer, it will be covered, as it were. So it's a very exciting time. Many boroughs don't have full coverage, but for Merton, it means we will have 100% coverage. And part of the work that we are doing within that is really linking in and making what we call the whole school approach. So if needs are identified in the school cluster, how can the schools use their assets that are within the schools to address some of the needs that have emerged? Because we know that the needs are increasing because of several reasons, some of which we've just mentioned around the pandemic. The other thing that we're doing around specialist pathway, and that again, we have noticed from pre-pandemic that the referral sort of, during the pandemic, referral sort of dropped, but we've noticed again an increase in that sense. However, the increase also has brought along complexities of referral. So we're seeing more complex cases coming into our CAMHS pathway, as it were. And so it then increases waiting time. So part of what we're doing within that is increasing capacity within our SPA, our front door, which is the single point of access. What we are doing is we have, the person has just started we're in January. She started in January, that's right. And what we have is, we are building capacity, or we have built capacity where we have a CAMHS worker who is linking in with our schools so that our children and young people who are on any CAMHS waiting list, as it were, can have the interface with her and the schools and can address some of the challenges that are presented so that they can review the risk and how they can address it as a system. The other thing within SPA is we're introducing what we call brief interventions. We acknowledge that sometimes young people might be referred into that and then they're on a waiting list sometimes, whereas some brief interventions might reduce the crisis, as it were, so they don't need to go into waiting lists and they can be helped in different domains. So that has also been introduced within that. And then we have a 16 to 17-year-old self-referrals into CAMHS themselves. So that's also something that has been galvanized. Thank you. Next slide, please. Thank you. The crisis pathway was something that's within the long-term plan and is moving forward. It's across the Southwest London region. And so Merton Place, of course, is part of the Southwest London. So that is being developed. And I'm sure most of you might be aware, or if you're not, we have the 111 option 2 around mental health, which is very much something that is on offer. The other thing that needs to be mentioned is iThrive, and perhaps I should have brought iThrive earlier. So iThrive is an integrated way of working, and in the Southwest London region, Merton sort of launched. We were first to launch it, and so we have very much, it's around systems galvanizing together to support our children and young people, and very much focused on needs rather than diagnosis. So we are saying that sometimes somebody might have, let's say, depression, but the way the depression affects or impacts them is different from me to somebody else. And so what is the need if I have that, if I have depression, how is that impacting me and how can systems support me? It's very focused on needs. And so we are working across our systems, local authorities, schools, public health, all the systems have been working around how we achieve that, which is really exciting. Some of the lessons that we have learned, the other areas that are going to introduce that in Southwest London, we are sort of going to share some of those learning to support the launch. The key thing around that is that our provider, our main provider is Southwest London and St. George's, which means that it's going to be very, it's going to be easier for us moving into the next phase, which is around looking at the risk support element, or what we will call the tier 4, tier 3, tier 4. So that is an area that is in development, or we are working towards. Thank you. Next slide, please, Clarissa. And then we have help for our children at increased risk. And this again is very much around Southwest London galvanized. But in Merton, some of the things we have started to put in place is around our youth justice service. So within our youth justice service, we have a CAMHS worker, and that's something I think in Merton we have done very well in, is that CAMHS is often co-located in different environments. So rather than our children and young people moving from schools to be seen for an appointment in an area, the systems, the workers are embedded in schools, they are embedded in the youth offending team or the YOS team. And so they are able to see the children at the right place at the right time, if we were to put it that way. And so within that, we have a clinical psychologist who is very much looking at how he can inform some of the assessment through the lens of trauma, and also providing consultation for our colleagues or colleagues in social care and other areas. The other thing that we have also done, or we are doing actually, and is a challenge, we're just waiting to recruit into that. We have had several recruitment challenges, is around our pupil referral units to really increase support, emotional health and well-being support within that domain. So that's something we are working towards as well, including working with our named nurse for our children who are in care at the moment. These are some of the work that we are doing in the borough. Thank you. Next slide, please. And then we come to our learning disability domain. And this is an area that, again, during the pandemic, we have seen very increased challenges within that area. I think some of the narratives we had for our young people were initially during the lockdown, our young people were thriving because they didn't have any expectations from school. But of course, it did change, and it impacted a lot of behaviors that parents were seeing that became challenging for them to cope with, were presenting as an issue in an area that we are working towards. We have, as a result of some of these, increased some of the CAMHS capacity in Cricket Green, and also because I think the pupil role was increasing. So that has formed part of the capacity we've increased within that. And we are trying to develop a learning disability service that is linked into Southwest London and St. George's to support that delivery. So that is something that is happening. The other area around the behaviors that are challenging is around training for what we call positive behavior support. So it's something that has been commissioned so that our workforce can be trained so that they can work with those lenses. And part of future plans is to see whether we can even form a community of practice around how we support our children and young people or our families to cope with some of the behaviors that present and they find it really challenging. So these are some of the work that we're doing. Thank you, Clarissa. Next one, please. And then we have investments. I think here the key area I wanted to mention is for the first time, well, Mark is here, so he may want to contribute to that. I was thinking for the first time we have quite an amount of funding coming through the system, but we are struggling to recruit the right staff to deliver the service. And this is a key challenge nationally, across all the national areas in CAMHS that has presented as an issue. And so as a system, we're working with our colleagues to really address some of those challenges as a Southwest London-wide approach. And as you can see, it forms a key area of the local transformation plan. And then we come to our suicide prevention. Thank you. Next slide, please, Clarissa. The other area that we have seen as a challenge, I think Julia mentioned and Dagmar talked about the eating disorder, the increase or the spike in referrals into eating disorder. Some of the challenges we have also seen, as I mentioned, is a complexity of need that we are seeing presented to services, and also tics in our children and young people. There's been a rise in tics for our children and young people. And so that's an area that we are working locally to see, to address. The other area is around self-harm and suicide prevention. And this is an area that we are working across as a Southwest London region, as well as in Merton Place. So some of the things we are starting to do is really bringing our mental health support teams, which from February, as I said, we will have all our schools represented to discuss a pathway that will support schools when our young people go into school and these concerns are raised. How do we support them? How do we signpost them to appropriate services? And how do we even support parents who are concerned around these discussions? is a key area we're working on. And with that in mind, also the suicide prevention work that is being done is very much around training. And I know that across the Southwest London, there has been a commission of training for schools so that we can raise awareness within the school environment as to some of the indicators, because we do know that suicidality, suicidal ideation, or self-harm, it doesn't sit in isolation. It's as a result of several psychosocial factors that could be impacting the young person to be feeling that way. And so it's really addressing it as a system, because it's not, we can't just address it as a health. We will lose the emphasis of some of the complexities that might exist in the homes that we are challenged with, a bit like what we heard about the food poverty, a bit like what we heard about the things that are happening, bereavement, and also. So it's very much around working as a system to address that. Thank you. Next slide, please. Thank you. So the next steps, thank you, is basically the draft. As I said, this was in draft. The questions that we have posed would be really helpful if we can have any feedback around that. And I think the idea is to have it published end of this month, I think. So we are just sort of a few weeks away, if not next week. And I think that's the end of the presentation. Thank you.
Thank you very much, Sarah. A really hugely comprehensive and passionate presentation, and so much within that plan as well. I know that you had a couple of questions, sort of key questions that you wanted us to consider. I don't know whether anyone has any comments or points on those. I think they were specifically related to prevention and early intervention.
That's true.
I suppose one initial sort of question from me is around, I suppose, specifically around that point, and there might be some young people who feel sort of a sense of stigma in terms of presenting to services. And I just wondered how much work you're doing and planning to do around sort of I suppose, areas that aren't seen as services so much. I think we do a lot of work in Merton, for instance, with our libraries, with things like Health on the High Street, etc. And it's just a question about those sorts of spaces that maybe young people feel are sort of safe spaces, not necessarily clinical, and what more we can be doing as well to support with that.
Yeah, that's very helpful. Part of the work that is being done around that, I know that off the record, our talking therapy sort of did some work during the pandemic. They did what they call the Barber Challenge, or Barbers Challenge. They sort of went into the local barbers, especially around where they are placed, which is Mitcham. And they really enriched that way through the local barbers so that they could get some of our young people who necessarily will not access sort of emotional health and well-being support. And we're engaging them at that level. So that was a piece of work that happened. And I think it's planned on an ad hoc basis to sort of continue. The other areas that we need to promote more of, and we have formed what we call mental health support leads in schools forum, where it's promoted, these services are promoted. And also I know that in education, Jen is here, so she'll attest to that, is the Senko forum. So some of these are promoted. We also have CUTH. CUTH is an online talking therapy forum, which is anonymous, or is anonymized in that sense. So people can log on, our children, our young people can log on anonymously and just seek help. And also we have that provision also in off the record. But I must admit, we still have a lot of work to do around really promoting it. And I think this is where the youth parliament or our young inspectors play a key part and are involved in different ways. And I think in future, that's more the area that we need to really increase, because they have their ears to the ground in many ways than we do.
Thank you, Sarah. Clearly a huge amount of work ongoing already under that. Ellie.
Thank you, Sarah. That's, yes, a very broad and ambitious piece of work, and I suppose I just hope it all works, and I hope we can make things better for our children and young people. And you're right to point out that workforce issue being so critical here, and I get that. It mentions a couple of times in the paper support around discharge, and I suppose I wanted to raise that because speaking to schools, that's one of the things that they are concerned about, is not just the stepping up when children, young people need support, but then the stepping down when they've been through a crisis. The schools don't always feel that they've get enough support to work with the young people at that stage. I just wondered if there's anything more on that than is written in the plan.
That's a key one. And it's a key one that we are addressing. And this is where that post that we have recently created around the SPA, the single point of access, and the link to schools. That was a feedback we got. And we did a sort of I don't know whether to call it a focus group because it wasn't with that intention, but we wanted to hear from the ground, from the teachers, from SENCOs, from some of our workforce around that key issue. And the idea was that sometimes there's a disjoint. Sometimes also we hear that CAMHS are not represented in what we call the team around the family or team around the child meetings. And so it's not informing, CAMHS are not informing that process. So that post has been specifically developed so that we have that discussion. And we are also doing some transition work. Our colleagues in local authority, the transitions team, are doing some transition work so that the step up and step down approach, I should say, is very much linked in so that there are no gaping holes emerging for our young people. So yes, this is something that is in the pipeline and we're working with, and it's a continuous challenge that we need to bear in mind. Yeah.
Thank you, Sarah. Were there any final comments or questions to Sarah? No, I can't see any. So just to say on behalf of the board, thank you very much for coming and presenting to us. A really, as Ellie said, comprehensive and ambitious report. We wish you all best with it and for us to be able to support you in that, and hope to see you again at the board soon.
Thank you.
And I think that brings us to the end of the meeting tonight. So thank you all for your contributions and have a lovely evening.